can actually detect up to 64 mutations in less than 5 hours. And these are the mutations that we're detecting, 64 mutations for all the drugs defining XDR-TB, that is INH, rifampicin, fluoroquinolones, and second-line injectables. And why sequence TB? Because this is the gold standard. And knowing the sequence and its association with the MIC makes prediction of drug resistance so much more accurate. And we've actually, with our NIH counterparts in the US, have actually formed a pyrosequencing library. So the ones in red are the bad mutations, the ones in green are the not so bad mutations, and the ones in white are actually the silent mutations that don't mean anything. So we have this huge amount of data by which we can tell you, yes, your patient has very, very high level, this very high mutation that codes for high level resistance, or this mutation doesn't mean anything. So it's accurate. We can, your different mutations that confer different levels of resistance are possible to be defined. It's flexible, but it's expensive and requires training. And I'm going to end with this case. This was a little girl of 2 years old. She was being treated elsewhere for fever, chest, and a chest infiltrate, and was started on first drug AKT. 2 months later, she presented to our hospital with drowsiness, seizures, and ptosis. And as you can see this horrid X-ray of her, CT scan of her brain, you can see them. It's riddled with tuberculomas. She even has tuberculomas in her spine. And she was, let's face it, she was dying. This was the child's mother, who was on first-line AKT for 4 months and was without improvement. Whilst we were awaiting the cultures for this mother and this baby's gastric aspirate, and it was changed to second line by the treating physician, we said, let's run a pyrosequencing on her. And this was, we did a pyrosequencing and found that she was clearly XDR, and she was high-level resistance to all the drugs. At this point, this baby was dying. She was put on IV dexamethasone, and treatment was started, salvage treatment as we call it, with PAS, clofazimine, amoxicillin clav, and linezolid to pick up, as well as cycloserine and clarithromycin, to pick up the total score of 4, which is what has been recommended by Caminero. Oops, it's not moving forward. You just see what's happening, it's not moving forward. Yeah, okay. We did the sputum of the mother, because she was still positive by both by the Hain, and we found that she was definitely MDR as well as resistant to, and XDR was confirmed in both the mother and the baby by cultures, and a needless delay of 4 to 6 weeks was avoided. 2 years later, when this little girl came actually skipping into my room to collect her follow-up report, she was fine. She and her mother owed their lives, I believe, to a technology, not only that they were lucky enough to have, but to the physicians who believed in it. They didn't waste their time tampering with, oh, let's give this, oh, you don't know, let's give that. Because we could actually tell them, yes, this was high level. Don't waste your time on giving this pill burden to this patient. Today, both of them are alive today. So, and I honestly believe that with drug-resistant TB, treat as if it is the last chance to cure the patient. Ask for contact history, and the choice of second-line injectables clearly depends on the pattern and prevalence of mutations wherever you are. So friends, this is the future. Definitely in 3 years' time, I can assure you, we're going to have an ICT for picking up TB from urine, and these are going to be our labs. These are labs with whole genome sequencing. These are labs that are going to tell us, we're going to just sequence the whole genome. We're already there. We have these nanowires that, for the cost of 120 rupees, are going to map the whole genome. Currently, we don't know what that means, but we will get there. But remember, India has 25% of the world's TB. Each one of you have a responsibility. Someone in the world dies of TB every 18 seconds. So I showed you 1 billion people die. We continue to die of this disease, and it's up to us to stop this. Thank you.